So ELAINE-1 is a randomized phase 2 trial that was presented by my colleague Matt Getz, but we participated in the trial, and it's a really interesting agent. Lasofoxifene is a novel SERM, seems to be very effective, and particularly effective in patients who have ESR1 mutation. So really fascinating. And what we did in that trial was randomize patients to receive lasofoxifene or fulvestrant, so they can't have received prior fulvestrant. And what we saw was a numeric improvement in the progression-free survival and response, but it wasn't the endpoint was PFS. In terms of statistical significance, it wasn't significant, but the difference was really quite, I think, nice to see, going from 4+ months to 6+ months. So really encouraging. And the important thing about ELAINE-1 was it just wasn't any patient. Because lasofoxifene has this sort of activity that had been seen in ESR1 mutant disease, we narrowed the eligibility to patients who had ESR1 mutations. And so then they looked at specifically this ESR1 mutation that's been associated with resistance to fulvestrant. And in that group of patients, we looked at ctDNA to see what happened to ESR1, so cell-free DNA. And people have shown that when you effectively treat a cancer, that the ESR1 goes down in cell-free DNA. We've seen this with a number of markers, even PIK3CA mutations. But when we looked at that resistance, the ESR1 mutation, like now we understand there's not just one, there's lots of them. The ESR1 mutation associated with fulvestrant resistance, it went way down, like 80% in patients who received lasofoxifene, and it actually went up in the majority of patients who received fulvestrant. So fascinating data. There's also an ELAINE-2 trial that was presented at ASCO, and in that trial, abemaciclib was combined with lasofoxifene and saw very nice responses. So the next planned trial is to look at lasofoxifene and abemaciclib versus fulvestrant and abemaciclib in a more registration trial type trial. And of course, when we're thinking about new agents, we always want to think about toxicity, and lasofoxifene is very well tolerated. And in this phase 2 trial, we didn't see thrombotic events. With abemaciclib, we'll have to watch that very carefully because we know abemaciclib is already associated with some thrombosis, but very, very interesting data.